Hi guys, again Melissa Lara. We'll go over some exercise again for physio exercises for your rehab arm. When you fracture your arm, in my case that I fractured the two bones, usually the hand and the fingers and the wrist are likely to be swollen or numb, or it takes a long time to actually be able to even bend it. Like even in the morning you'll notice they're like cramped, like you can barely move it. You're like using the other hand to be able to bend it. So in this case, I'll show you some exercises and some tools that you can use. So usually if you cannot bend it, try the water exercise video that I post. That one is a must. Like put it on cold water for 15 seconds, then move it to hot water for another 30 seconds, doing circular movement and moving the fingers. Okay, now for those exercises that is without water, and if you just came out of the fracture surgery, then consult with your orthopedic and your occupational therapy when you're supposed to start doing something like this. Usually maybe in my case it was 2 weeks, almost three weeks after the operation. So this is how I started. Try not to put your elbow, because it support your, put your weight on the elbow, because it's going to damage or constrain your nerve. So just try to keep it like straight. So just moving exercise, use the other hand to move the wrist, and try yourself to just move it like this. If you can do it yourself, great. If you can need to use the other hand, then use it. I know it will be swollen and it will hurt a lot, so just don't pressure yourself too much. I usually started counting 5, 1, 2, 3, 4, 5, and then move it the other direction, 1, 2, 3, 4, 5. Another exercise was mainly for the fingers, so I will start with this finger. I'll be bending it like this, 1, 2, 3, 4, 5, and then another 1, 2, 3, 4, 5. So each finger is like that, bend it, and then straight pushing, then the other one, and then like this. You see, even if I try to do it myself now, it's better, but I've been doing this for already 3 months. In your case, if you just came out of the fracture, you might need the other hand. Once you do finger by finger, I will suggest 30 repetitions. I will use all the fingers. So 1, 2, 3, 4, 5, and then straight, 1, 2, 3, 4, 5, and then the last one with the whole wristband, 1, 2, 3, 4, 5. Okay, another exercise is just move the wrist, so to one side, to another side. I know it's hard as soon as you came out of the fracture, but try to do it. Even if you don't see much movement, I know it is pushing. So you go to one side and count 5, and another side. Another exercise is to try to move the fingers separately. And this one I was not able to do it, and I still, by now I can do it with my other hand, but I still cannot do it perfectly with this hand. And again, it's because the my ulnar nerve is getting in rehab, like it's getting healed. Once I stop using the dinah splint that constrained the elbow but breaks the scar tissue, then the nerve will be focused, will be fully unconstrained. So these are some of the exercises that you can use. Another one is are basically just with your hand. If you email me at contact@melissa.consultant.com, again, contact@melissaconsultant.com, I'll be able to send you a handout where you can actually see the exercise graphically and make it easier for you with just the hand. Okay, I'll show you one more two more exercises in my next video. That one actually used something that I call Play-Doh, but I don't think it's Play-Doh. But you'll see it right away. You'll know what it is. And then another tool that that I found online that helped, but I would suggest to use those ones basically after a month and a half to 2 months of your fracture. Don't use it right away. You will have to be patient with yourself because this exercise does take time. Last exercise is this thumb. So this thumb will be very hard to move. So another exercise is just to try to bend it. If you can't do it by yourself, use the other hand to support. And then once you are able to do that, try to add this one. So just like that. Okay. I usually use both like this. And then again, count 5, 1, 2, 3, 4, 5. Then move to the other one. And that's like 30 reps again, I suggest. The most important thing is to keep moving it. I was just doing this in your first month or second month, at least every 2 hours. You will see how your hand gets numb. And something that my occupational therapy suggested a lot was massage. Believe me or not, it helps a lot. So just massage yourself, like do circular movements on your fingers and on your whole wrist, like a lot. In textures, if you feel numb and you need to feel that sensation again, find different textures. Like you can find cloth, like you can see this material is kind of a bit rough. So try to touch like rice, beans, try to grab it with your hand, even if you can hold it, just feel it, just feeling different textures from rice to beans, to pasta, even if it's textures on cloth material, just rub it in and use different materials to feel different textures, and you'll see it does help bring back your your sensation on your hand and your fingers. Okay, so hope you like it. I'm going to show you my next video, the exercise with the Play-Doh and another tool, and this one is mainly more recommended like on your second or third month, once you actually feel more strength on your fingers, and then you can actually use these other tools. Okay, so see you on the next video.